Hello everyone, my name is Dr. Masar. I am Assistant Professor in the School of Medical and Allied Sciences, K.R. Mangalam University. Today, we are going to start a topic on the types of toxicology and how the branch is evolved in the present time. The human life has a very strong relationship with the medicine since the beginning, from the inceptions of the life. And to protect themselves, the humans search various plants and herbs for treating the disease. And in ancient history, in ancient India, the different technology was evolved for the preserving the data. Initially, the human used plants, plant parts, animals, and minerals for treating the disease. Later on, this information is continuously evolved and codified into structures, into treatises like Rig Veda, Yajurveda, Charak Samhita, and other literatures across the India and globally. In ancient literature, it is evident that initially humans used some technology and some initial extract for treating the illness. But my question to you is that how the humans use for the discovery of the medicines, how the toxicology evolved. After the observations of humans or the initial humans observe the surroundings whereabout they are living, they are correlate the structure. As we already aware that the plants, animals, minerals have a different structures and shapes. Might be this is possible after the absorptions, after the keen observations, the initial humans use some shape and size for the determinations of their toxicological activities. Let's take an example of Karela. Karela, you must be aware of the Karela. That's a very prominent fruit in India and used as a vegetable across the country and across the globe. This Karela, the scientific name is Momorodica charentia. It looks like a pancreas. For initial use, the Karela is used as an anti-diabetic therapy. And with the use of modern science, it has been proven that the Karela, the Momordica charentia, has anti-diabetic potentials. Let's take another example. You might be aware and you have seen the walnut, the kernel of walnut, the kernel of Jaglus regia. The scientific name is Jagnus regia. The walnut is look like the human brain, and initial Vedas, initial Vedic Pandit and medical physicians, practitioners use the walnut as a brain tonic. From this, we can conclude that India has a long history of medical practitioners and a long history of medical science in the India. Apart from it, in 1703 AD, the Kavi Tanang wrote in his scripture that many Persians and Greek scholars came to India and learned from the various Pandits, Vedas, and they collaborated several studies to find out the medical status and medical formulary in India, and they went to their countries after learning so much from this literature, Vedic literatures. After that, next term, come to the next term, the toxicology. Anybody can define the toxicology is a science of poison. But my dear students, it is not as simple as in a single word would say that the toxicology is the study of the poison. People will evidence that the Webster dictionary say the same thing, the toxicology is the study of the poison. But my dear friends, it is not as simple. It is the interactions of material. Material could be a drug, a food, a chemical or pesticides and their interactions with biological interactions and its response with the end users. This is the toxicology. And the word poison has lost its relevance in today's world. Why? The reason is that the poisons and the Act Poison in 1918 has legislated in 1918. It's been a long history. The poison and the science has been evolved. So the definitions is quite different from since and now. The Paracelsus, who can be the father of the toxicology, said all substances are poisoned. There is none which is not a poison. And he emphasized on the fact that the right dose differentiate a poison from a remedy. It means there is a slightly difference between a poison and remedy. As per old Sanskrit adage and old sayings says that even a nectar means amrit. Amrit is a term medicines can be used to eliminate the mrityu or death from the poisons. And in literature he says that if amrit is used in high concentration, in high volume, it could cause the death. Now my dear friends, let's take an example of arsenic and mercury. These two drugs have been very heavily used across the globe for many illnesses across the globe. Arsenic and mercury, and as per the data, as per the various toxicological agencies across the globe, we evident that till date no agency is allowed any quantity of mercury and arsenic any product used for human life or for animals consumptions. It is strictly prohibited the consumptions, additions, either intentional or intentional use of mercury and arsenic in the formulations. Apart from it, let's take an example, the toxicology. Toxicology is a field of science that helps us understand the harmful effect that chemical substances or substances can have on people and the environment. Next, take another example of Bhopal gas tragedy, that is devastating industrial disasters that happened during 2nd and 3rd December night 1984. The gas is known as a methyl isocyanate. The company United Pesticide Company is a company of a government of India and manufacturing certain pesticides used across the nations. The leakage of methyl isocyanate lead to the 3,500 deaths within our days and nearly 800 days during the next 2 to 3 weeks. This is the impact of poisonous gases across the globe. Thus, it becomes essential for us to read, to study, to investigate, to evaluate the toxicology of every product. Apart from it, refer back to the toxicology definitions. The science of safety, because as a field it has evolved from the science focused on studying the poisons and adverse effects of chemical exposure to a science devoted to studying safety. We have another two examples, DDT and thalidomide. Thalidomide was discovered as a safe sedative for pregnant women in 1954 by Camille Grünethal in Germany and Distillers Company in UK. It was marked under the different names like Distabal, Contagion and others names. It is also used for morning sickness across the globe in pregnant ladies, particularly for mo- morning sickness, and it is recommended for initial 7 weeks, and the result for the end user was devastating. A number of child born after consumptions after administering the thalidomides. The newborn babies are born with several disorders and they found their limbs are joined with each other and they termed the joint feet focomelia. Focomelia is a term used when a newborn baby is born with joint feet. It also emphasizes the role of each drug, how we are administering the drug to pregnant ladies. However, the US never allowed this combination because of nerve ending and nerve pain problems. Thus, the US population saved themselves because of rigid regulations used for the approval of the drug. In this case, the thalidomide disaster, a large number, 4,000 to 5,000 of deformed children born during a short period, altered the medical professions and toxicologists and alerted all the clinicians who traced the deformities as due to the thalidomide taken during the first 7 weeks of the pregnancy. It means during the administrations of drug initially from first week up to 7 weeks have a significant role in bringing any abnormalities, any anomalies, any teratogenic activities in fetus. Further, toxicological investigation in animals proved thalidomide to be a teratogen or a chemical capable of producing malformation in fetus. Now, my question to you is that what is teratogen? The teratogen is a chemical that is capable, that has the efficiency that is producing any changes in the genes in fetus during the pregnancy. It is become unnecessary for any drug marketed to conduct teratogenic activity before the approval in European and US market. The US and Food Drug Administration, that is US FDA, had refused the permission for import of the drug not for teratogenicity reason but for suspected productions of nerve lesions. That was the major reasons that US FDA denied the permissions for US for thalidomide in their country, and thus they saved their populations with this devastating loss. Now, in our homes, you must aware that children are playing. Sometimes they affect with several disorders while eating. Let's take an example. Children are playing at home. They can eat. They can playing with the face powders, makeup powders. They can inhale any quantity of the makeup powders or any makeup materials. After inhaling, they might be feeling any kinds of several disorders or several abnormalities as it contains high amount of heavy metals. Upon the visit of the hospital, they might concern with the doctors and a medical doctors will treat him. Then the medical doctor will be termed as a clinical toxicologist. And in poisonous cases, the mostly anesthesiologists are trained for treating poisonous cases. So we need anesthetoxicologist, we need medical toxicologist, we need forensic toxicology in case of suicidal and for crime cases. Thus, toxicologist is required from each domain for conducting the safety of a chemical at each level.